Hi, I'm Dr. ห์cie·puis·𝗀𝗶𝗰𝗹 with Pro Sport, and today we're going to talk a little bit about why we might recommend surgery versus rehab for various adolescent or pediatric sports injuries. And so, in general, at the end of the day, we want to do our best to predict whether or not a patient's going to do well with one treatment or another, both in the short term and in the long term. And to arrive at that decision, we have to consider a lot of factors. The first one would be just the nature of the injury itself. We know some injuries are unfortunately just not going to do well in the absence of surgery. You know, if someone has a displaced bucket handle meniscus tear where their knee is stuck, they can't bend their knee. Whether you're an elite athlete or a fairly sedentary person, it's unlikely you're going to do well without surgery. So we have to consider factors like that. There are other injuries where we know quite the opposite, you know, that very few patients ultimately require surgery, and we can certainly pursue a variety of non-surgical treatments, knowing that majority of those patients are going to do well without surgery. The second factor we have to consider is both short-term and long-term goals of that patient. You know, how active do they hope to be at that time, and what are the long-term, goals in terms of activity level, sport, things of that nature. We also have to consider perhaps what they've tried up to that point. So, sometimes an athlete will have an injury that we often know can be treated with physical therapy or chiropractic sports rehab. And perhaps they haven't attempted any of that at that time. You know, it's certainly a case where we will, send them for a trial of rehab and just gauge how are they going to respond. You know, how quickly are they going to improve? Are they going to plateau at a certain level? And if so, what's the impact of that diminished level of activity? And does that justify perhaps being more aggressive? So we have to consider those sorts of things as well. The other factor is that, kids in general, they're growing. So, it's a moving target. We have to consider the impact that further growth will have, both on their mechanics, and particularly in the context of treatment options. We know that different treatments can impact the growth, particularly with surgery. If someone has an ACL tear, we may modify how we do certain procedures to account for that expected growth over time, and that may also have an impact into our decision making. Sometimes we try to hold off on surgery for exactly that reason, to see, well, let's see if we can, improve someone's function through just rehab alone and spare them the surgery. So these are the kinds of things that we have to think about. And, it's a very individualized thing, and it does involve a bit of nuance. And so this is where we need to have a very honest, real discussion with the patient and the family to collectively arrive at the best decision for them. So I hope that helps, and please reach out if you want to chat more about this.